Learning English with English faculties.
Hello, everyone, and welcome back to English Faculties. I'm so glad you are here today because in this video, we are going to do something really exciting. We are going to write a nursing referral letter together, and we are going to do that step by step from scratch. If you are a nursing student preparing for the OET, that is the Occupational English Test, this video is made just for you. By the end of this video, you will know exactly how to read a case note, how to organize your letter, what language to use, and how to turn those short notes from points into beautiful professional sentences. Grab a pen and paper if you need to take notes, and let's get into this. This is a very simplified version of a writing subtest. We designed this for students who are just starting to write, the OET letter. The first thing that you have, the very first thing you must do before you write even a single word is read. Read this task instruction carefully. Many students make the mistake of rushing straight into writing. Don't do that. Take your 5 minutes. You get 5 minutes to read this and take it seriously. Okay. So let's look at what this task is asking us to do. It says you are a nurse in charge in Holy Angel Hospital, Australia. You are now referring a patient, Michael Johnson, 42 years old, to the neurosurgeon for further management. Now, from this one sentence alone, we can already identify four very important pieces of information. Number one that he can do is, who are you? So you are the nurse in charge. It mentions here, you are the nurse in charge. And this tells you how you will sign off your letter at the end. Now, number two, who is the patient? And that is Michael Johnson, who is 42 years old. So Michael Johnson, 42 years old. Number three, who you are writing to. So to the neurosurgeon, you're writing to the neurosurgeon. And we know from the writing task that this doctor's name is Rubeus Hagrid. And that is, once you scroll down, that is given. Okay, so that is given here. That is the next step. But since I've read this, so I know it. Okay. Number four is why you are writing. And for this, again, you will get it here for urgent assessment. One thing you need to do is you need to read the first paragraph and then you should read the writing task. I can advise you to go straight to the end of the task and see what the writing task is. That is also a good way to do it. You can go straight. When you get this, you go straight down to the writing task, see what the task tells you to do, and then come back and read this part. That is also a good way to do. Now, the word urgent is very important here. It is not just background information, it tells you the tone and nature of this letter. Your letter must reflect this urgency. Keep this in mind as we write. So, the word urgent here, right? It is of utmost importance. Let's go to the next thing, and that is reading the case notes. Okay. We'll read this section by section. When you read case notes in OET exam, you need to ask yourself one very important thing. What does the person I am writing to need to know? Remember this. What does the person I'm writing to need to know? In this case, the neurosurgeon needs to know the patient's background and what brought him to the hospital, what was found on examination, and what the investigations showed, and what the diagnosis is, and what the plan is. So basically, when you're writing to a neurosurgeon, he needs to have an idea about the patient, a little bit about the background. How did he come to hospital, or why did he come to hospital? What was found on examination, and what investigations were done on him, and what investigations showed, and what the diagnosis is, and what is the next plan. Okay, let's go through each part of the notes and see how it goes. What is first thing that you do is to find out patient details. If you want to make notes about this thing, you can do that. So the first thing that you find out is about patient details. Now, I'm saying find out, but what I actually mean is to highlight. Okay. Patient is Michael Johnson, 42 years old, right? And he is an IT professional. That is the basic identifying information. Okay. And this goes in your opening para, right? Para or paragraph. I'm saying it short for paragraph. So this goes into your opening paragraph. That we need to see is medical history. So in medical history, we are talking about headaches and blurred vision for the past 2 weeks. So headaches and blurred vision for the past 2 weeks. And then it goes on to say no history of recent trauma or fever. Sometimes you can have this with some trauma that is related to fever. So it very clearly mentions here that there is no history of recent trauma or fever. This is the presenting complaint. That means this is the reason why the patient came to hospital. Okay. Now let's go for past history. It says hypertension controlled with medication. This is important context for the neurosurgeon. So include it. So it says hypertension controlled with medication. And this is important for the neurosurgeon. So do not forget to include it. Then let's go for assessment. What is the assessment? He appeared in distress due to severe headaches. Okay, so multiple times he had headaches. So he appeared in distress due to severe headaches, vital signs within normal limits, but blood pressure was elevated. He had papilledema on fundoscopy. Papilledema on fundoscopy means swelling of the optic disc, seen on eye examination. So when they've examined, they have seen the swelling of the optic disc on the eye examination. And importantly, no signs of focal neurological deficits. All of this goes into your letter. All of this has to go into your letter. Then the next one that you need to read is investigations. CT scan of the brain, no acute abnormalities. MRI of the brain showed large intracranial mass in the posterior fossa. And this is the key clinical finding. It is the main reason for referral. So you're referring him, but this is the main reason. And then diagnosis. Diagnosis is posterior fossa brain tumor. So this is the diagnosis. Now, if you go further, you will see management. Management is what is being done. How are you managing the patient? So medications prescribed. So prescribed medication, but it should be actually medications prescribed when you write. This is just notes. So it may not be in the right grammatical order. So medications prescribed for headaches to prevent complications. So it should be basically medications prescribed for headaches and to prevent complications. Okay. Then comes to plan. Now, plan is neurosurgeon opinion for further management. He will undergo surgical resection of the tumor, followed by radiation therapy and chemotherapy as indicated. Monitor closely for any changes in symptoms and response to treatment. This is going to be the plan that, you're writing this letter. So you're basically writing this letter for a surgical resection of the tumor and followed by radiation therapy and chemotherapy, as indicated. And you have to do a close monitoring of the patient. Do you see how the case notes are written in short? It is incomplete phrases, right? Now, your job and every nurse's job when you're writing this letter is to understand that this is the heart of OET writing task. It is to take these short phrases and turn them into full, clear, professional sentences. And that is what the examiners are testing. Your skill to put these notes in professional sentences. And that is what the examiners are testing you for. Now let's move to writing this letter or the letter format. Before we start writing the content, let me show you the correct letter format. A professional letter has specific structure, and in the OET exam, you must follow it. Now, OET doesn't say that there is any such template that you should use for your writing test, but to make things organized, it is important that you have this letter. See, when you're sitting there in the examination hall, there are two things that will matter the most. First is what to write, and the second is how to write. If you learn this format, if you practice on this format, you will eliminate or at least you will minimize the how part, how to write. The format is there. I know the format, so you can write it. Now let's come to the next section. That is the letter format. Letter format. Before we start writing the body of our letter, let me show you how to lay out your letter correctly. There is something very important that I want to tell you first. The official OET guide actually states, and I'm going to quote it exactly, there is no particular format or layout that you have to use in the writing subtest, though it is important that your letter is clearly laid out and appropriate for the particular task. This is exactly what it says. There is no particular format or layout that you have to use in the writing subtest, though it is important that your letter is clearly laid out and appropriate for the particular task. So OET does not force you to use one right or one rigid template. What matters is that your letter looks professional and is easy to read. Now, that said, there is a widely accepted layout that works well for OET letters. And this is what I'm going to show you now. The first thing in the OET letter layout is the recipient details, the person who is receiving the letter, the name and designation of the person you are writing to. And you write this at the top of the letter, top left side of the letter. So we start with recipient details. Okay, this is the first thing. The second thing that you put there on the layout is the date. You write the date below the recipient details. We write it in full, right? Something like if today is, let's say, 18th of May. So we write, it has to be date and it has to be 18th May 2026. Okay. We do not write it as 18/05/26. Don't write like this. It should be day, month, and year. Always write the date on which you are appearing for your test. Okay. The third thing is salutation. Now, this is your greeting when you write to a doctor, when you write to somebody within the organization, or you're writing to someone of your colleague. You will use dear doctor, whoever it is. Okay. Make sure that you have this full stop at doctor. Okay. and you will have a comma at the end. Now, a very important rule here from the OET guide is that when you know the name of the person you're writing to, like in this case, we know it is Dr. Hagrid, you close your letter with yours sincerely. So when you know the name of the person you are writing to, you close your letter with yours sincerely. If you do not know the name you're writing to, name of the person you're writing to, and you're writing Dear Sir or Madam, then you close with yours faithfully. And always remember this rule. The fourth line in here is the RE line. This means regarding. It tells the reader instantly who the letter is about. So in our case, we will write re Michael Johnson, right? Michael Johnson. And then we put a comma and we say 42 years old. Mention as years and not as year. And a full stop. The fifth is the body of the letter. This is where all your clinical information goes. We will write this paragraph by paragraph together in the next video. But according to OET, the body should be approximately 180 to 200 words. Okay? And I want you to be very clear about what gets counted. The OET guide confirms that only the body paragraphs are counted. Things like recipient's details, date, salutation, all these things are not counted. And neither is the closing statement counted. Okay? Only the body of the letter is counted. Okay? Then comes your closing. Okay? Now, you end with yours sincerely, and then below that, you write your job title. And why do we use yours sincerely? That is because in this scenario, we know who we are writing to. We know the person who we are writing to. So how do we do your sincerely? Yours sincerely. And then below that, you do not write your personal name. So in this task, we know that the writer is the nurse in charge. So we write nurse in charge. And if you want, you can add Holy Angel Hospital, Australia. So nurse in charge. And you should have a hyphen in between. And then Holy Angel Hospital, Australia. One more thing that I want to clarify. This is something I want you to remember. You do not need to write your own address, the sender's address at the top. In OET letters, only the recipient details are needed at the top. Your identity is established through your job title in the sign-off. Now let's write the actual body of the letter, paragraph by paragraph.